Welcome to this video on maltracking of the patella, or as my auto-corrected notes want me to call it, maltracking of the paletta. In this video I'll be looking at what maltracking is, why it happens, and a potential way to resolve it. The patella is a small bone that sits in front of the knee. During flexion and extension of the joint, the patella should move up and down, following the movement of the tibia. Ideally, the patella will move in a vertical line, gliding smoothly in a groove between the two femoral condyles. We describe this as normal tracking of the patella. However, sometimes the patella gets pulled off course, causing it to rub on underlying structures. This is known as maltracking, and can be a common cause of anterior knee pain. So why does this happen? Well, often it's due to the muscle group that acts on the bone, the quadriceps. The quads are a group of 4 muscles that lie in the anterior thigh. Attaching to the femur are 3 vasti muscles, lateralis on the outside, medialis coming down a bit lower on the medial aspect, and although I'm not drawing it, intermedius would be in between them. We then have rectus femoris passing from the lateral hip and lying over the other muscles. Distally, all 4 heads attach to the patella via the quadriceps tendon. Finally, a patella ligament connects the patella to the tibia. When the quadriceps contract, they'll mainly act to pull the patella upwards. This in turn pulls the tibia forward and brings the knee into extension. Now at this point it's worth pointing out a subtle detail about the quads. Because of their attachment, all 4 muscles follow the line of the femur, passing from the hip to the knee. However, because the hips are relatively wide, but the knees are closer together, the femur runs obliquely, an anatomical term for a structure that isn't vertical or horizontal, but instead runs on the wonk. This means the quads also run at an oblique angle, and have an oblique pull. So when they contract, they won't just pull the patella upwards, they'll also pull it laterally. This force can pull the patella offline, causing it to maltrack or even dislocate. If a person has wider hips, the angle is more pronounced, and the lateral force becomes even greater, making them more likely to suffer from patella maltracking. Fortunately, we have some mechanisms that limit this lateral displacement. Firstly, the shapes of the bones help to keep the patella in place. Earlier we saw how the patella runs in a groove between the two femoral condyles. If we look at this groove from above, we can see that the lateral condyle projects further forward, creating a larger lateral border. This larger border helps to resist any lateral movement of the patella. Secondly, in the distal portion of vastus medialis, we find muscle fibres that run almost horizontally. Whilst most of the quadriceps group pulls the patella up and out, these fibres pull the bone towards the medial aspect. This helps to balance out any lateral forces and ensure the patella tracks normally. Weakness in these muscles can be a cause of patella maltracking, but equally strengthening them can be a good first step in dealing with a wonky patella. So, that's an overview of maltracking. If, like an errant patella, you feel you're on the wrong path, then please feel free to get in touch with any questions. But other than that, thank you for watching, take care, and I'll hopefully see you again soon.